Hey, it's Becky with the Cryo Releaser. Today, I want to talk to you a little bit about a pain in the butt, something called sciatica. Many of us have suffered from that, and when we drive a lot or sit a lot, which we've actually been sitting a lot, I'm sure, during this whole COVID-19 issue, sitting at home, sitting at our desk chair quite a bit at home, we develop some tightness in the butt and the hips, and we go to get up and we've got that pain in the butt. Typically it tends to be that sciatic nerve. Some people end up with the sciatic nerve being impinged more in the low back, but a lot of the times we'll end up with that pain in the butt, comes down, wraps around, and goes down almost all the way to our foot at times. So the Cryo Releaser, I've had a couple patients had great success with the Cryo Releaser. Not only one does it get really deep up into that piriformis muscle, is typically the muscle in the buttock region that tends to impinge that nerve, but also tight glutes will also affect it too. But the shape and the firmness of the Cryo Releaser really gets deep up in there. But I had a patient always wanting to ice it, and he said nothing just gets deep up in there. So I gave him my Cryo Releaser. Because this is filled with water, you do freeze it, and it stays cold for a good 2 to 3 hours, or depending on how often you use it, how much you use it. But so you're not only getting that deep pressure to release that tight muscle to let go of that nerve, you're also getting the inflammation the ice to decrease the inflammation around that nerve, because the nerve will get irritated, the tendons get inflamed. They call it, itis, any type of itis, tendinitis. It's inflammation. So the ice in the Cryo Releaser is going to help decrease that. So today I'm going to show you how to really get up into that buttock region and into the glute areas to release that tightness in the buttock region from doing times of prolonged sitting like we are right now. So what I tend to do, I can do it from a chair, but you can also do it here from the floor, whatever is most comfortable for you. If you can't get down on the floor, you definitely can do this from a chair. Find that sore spot in the buttock region. Basically, I call it right around the sits bone. It's called the ischial tuberosity, medical terms. So you want to get in there, and I'll sit and I feel the tightness right there. Okay, so the ball's right in that tight area. And then you want to do some external rotation, and that allows it to get really deep into there. And it is actually tender on me. I've been doing a lot of driving lately, so I have some tightness in there. And you just want to work the leg back and forth. Okay, you can, if it hurts to have it bent, you can even straighten it out and just kind of roll your legs side to side. Okay, once you kind of finally get some relief in that area, deep breathing is very important here. Okay, right now I'm talking and stuff, so I can't really do some real deep breathing, but once you do some deep breathing, you're going to really feel yourself sink into that area and let that muscle go, because of course it hurts, so we're clenching that butt region, so because we don't want to let go and sink into that area. So you want to try to stop, do some deep breathing, and really feel yourself sink into that. Okay, once you get a little bit of relief and you feel that let go, you can move around, and I'll get down onto my side and move down into the glutes. And again, find that sore spot. I just found a sore spot, and breathe, sinking in, letting go. Deep breaths are very, very key to really sinking into the Cryo Releaser, because like I said, it does get really deep. Okay, again, you can bring the leg up, do some external rotation if you can tolerate it. If you can't, then just keep that leg straight, and you can even roll your body. Okay, you're in a little bit more control if you roll your body, but I encourage you to work all around the glutes, because that can contribute to the tight rotator muscle called the piriformis. And again, you can bring the knee up, rotate it out if you can, and then slowly roll onto your back. So the position you want to go, or the spots you want to go, is in the buttock region, and then you want to come around here, 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 and then end up in your low back region. Okay, so once you come around in that little arch position, you can take it into your low back. Now I'm going to put 2 here. You don't have to have 2. It balances you out a little bit better, but you can do it just with 1 ball, and get it into like the curve of the low back here, And then I'll do some pelvic tilting. And that just kind of helps open up that lumbar region where it's locked up from us guarding and protecting so much. So you're just going to do some pelvic tilts and really wrap down around that ball. You can see my hips come up, and then you can feel them go down, and that's arching my back and really stretching that lumbar curve, okay? You can also go up a little bit higher into the curve and do that pelvic tilting. Okay. Sometimes, like, I do feel more tightness on the right side than the left side. That's real common. So if you just have one, just really work that area and focus on it. But if you have two, you're going to notice a difference sometimes between one side or the other being tighter than the other. So just doing some pelvic tilting, and that's going to do a nice massage in that low back region, okay? All right. So hopefully the information I just gave you on sciatica, or in other words, a pain in the butt, will help you get rid of some of that tightness. Like I said, we've been sitting a lot in our chairs at home, doing our work from home, sitting with our kids, doing homeschooling, or whatever. But hopefully you get some good information from this video today and try to relieve yourself of some buttock pain. All right, check out my website at cryoreleaser.com, and I've got some specials going on right now, so check that out on my website, and hope to hear from you soon. Thanks.